Hi, my name is Dr. David Schmuckler, owner of Kennett Chiropractic Center and author of the book Outsmart Your Fork, A Mindful Guide to Permanent Weight Loss. 6 years ago, I suffered a severe stroke where I was totally paralyzed on my right side and had great difficulty speaking. I also suffered from severe depression. When I was in the hospital and could not move my right arm and right leg, my neurologist told me to visualize my arm and leg moving. By visualizing my arm and leg moving, I was retraining and rewiring my brain. This rewiring has a fancy name called neuroplasticity. I used the power of neuroplasticity to make a full mental, emotional, and physical recovery from my stroke. Your brain rewires your entire life as long as you do new and novel things. Your brain will make new healthy connections, and the more you practice these activities, the healthier your brain becomes. Fibromyalgia is a chronic painful condition with widespread muscle pain. You have to have pain above and below the waist and have the pain for at least 3 months. There cannot be any other medical condition that can explain your problem. The most difficult thing to understand about this condition, even though your muscles are killing you and you're suffering from this muscle pain, there is nothing wrong with the muscles. It is the signals from your brain to the muscles and from the muscles to the brain that are altered. This is called central sensitization. In my opinion, your brain is not working properly because of negative neuroplasticity, and meaning you're thinking poorly and you're doing negative activities and you do them over and over and over, and then you just are suffering from chronic pain. Medically, fibromyalgia is treated with drugs such as Neurontin, Lyrica, and antidepressant medication. These affect your brain chemistry and sometimes will give you pain relief. Pain is a brain experience and is defined as an emotional response to tissue damage or potential tissue damage. In fibromyalgia, you're experiencing pain even though there is no tissue. Why? In the cases I have seen, their brain is not working properly, and they have effectively what's called negative neuroplasticity or negative wiring. Fibromyalgia has a strong link to depression and anxiety. One of the only clinical findings in patients who have fibromyalgia is elevated substance P, which is a stress chemical. This chemical sensitizes your pain fibers and is one of the reasons your muscles hurt so much. When somebody touches you, which should not cause pain, it is painful to you because of the elevated levels of substance P that sensitize the pain receptors. This is called allodynia, meaning when you're sensitive to touch when you really shouldn't be. If you keep thinking the same way and doing the same negative activities that caused your pain and symptoms, will get worse. You are stuck. You may not even realize you are doing these behaviors because you had the symptoms so long and you had the negative thoughts and the habits, and it's just become a habit now. If you just take the medication and go back to your life thinking the same way and doing the same things, why would you get better? It just doesn't make sense. The only way you're going to get better is to try something new and different. This will create positive brain plasticity and you can start enjoying your life again. If you get control of your brain and start thinking positively and doing healthy activities, your levels of substance P should go down, and as well as your pain. You have to keep repeating these new habits and behaviors until you get control of your brain and your pain. Every thought you have has a body consequence. If you think negatively, it has a body consequence, just as if you think positively, you develop new healthy habits and behaviors. I used the power of neuroplasticity to recover from my stroke without any medications. I'm not saying you can't take any medications and only your medical doctor can take you off the medications. Can I guarantee you a cure for fibromyalgia? No, nobody can, and if they do, it's quackery. I can only tell you the only way you're going to get better is to try something new. If you are interested in trying something new that doesn't involve drugs or surgery, give me a call at 610-925-0444. You can also go to KennettChiropractic.com for more information. Thank you, and I look forward to seeing you in the office.